Wednesday, September 15th, and we're really excited everyone can join us. We may have more people joining. There's been a little confusion with scheduling and dates, so our audience will grow, I'm sure. But I want to thank you all for coming and remind you that this is a virtual webinar that's being recorded. Before I introduce today's speaker, I just like to remind the audience that this is one in a series of conversations and seminars that we're holding focused exclusively on climate change and all of the various dimensions, from basic research to applied research across biophysical, atmospheric, and human systems issues, as part of our fall Rough Cut series here at the Institute on Ecosystems. And these are all recorded and saved on our website, so you can revisit them at future times. And I'm really pleased today to introduce Drs. Rob and Lori Byron, who are physicians that practice on the Crow Reservation in southeastern Montana. And they're not only dedicated members of their community and physicians, but also real professional leaders who hold multiple degrees and work in public health, in energy and environment policy. And they are important authors and inspiration behind this report, which was the second in a series of climate assessments that the IOE has helped lead. And they'll tell you where to find this, but we actually also have some physical copies if people are interested in getting those. So without further ado, and I'll just say from a logistics standpoint, the Byrons will give their talk, and it just works better online if you hold your questions till after they finish, and you can chat those questions or raise your hand, and we'll have moderated Q&A towards the end of the session. So thanks, Dr. Byron and Dr. Byron. We're excited to have you. Thank you so much for being here. I'll let you take it away.
Okay. Thank you, Julia. Let me share screen and there we go. Can we see it okay?
Looks great.
Okay, thank you. Again, thank you for the introduction and the opportunity to be here. One small correction, and that is Lori and I worked on the Crow Indian Reservation for a total combined of nearly 50 years. We no longer work there. And as many folks know, I'm an internist, Lori's a pediatrician. And our talk today is based on the Climate Change and Human Health in Montana report, but we titled it Danger and Opportunity. Before we go any further, as many know, we live in Hardin, and we would like to acknowledge that we inhabit the unsurrendered lands of the Absaluka or Crow people who've been stewards of their land for thousands of years. And we are both very indebted to the Crow and Northern Cheyenne peoples for their openness and the trust they have placed in us over the past many years. We'd also like to thank the many health professionals, health department employees, and emergency managers who are putting their lives on the line for COVID. Even though we're physicians, we aren't on the front lines for COVID, but appreciate the many that are. And to paraphrase Bill Gates, while we may have no bandwidth right now to start addressing another public health crisis, the reality is that we're in the midst of two of them, a fast-moving one and a slow-moving one. So this is the report, Climate Change and Human Health in Montana, a special report of the Montana Climate Assessment. It's available online at montanaclimate.org, which includes many hyperlinks to the references and others, so I encourage people to look at it there. Unlike the other reports in the series, the Montana Climate Assessment and the Greater Yellowstone Climate Assessment, this has an additional component to it, and that is that to really involve people, especially in the public. Our key goals in the report overall were to identify those aspects of changing temperature and precipitation most likely to affect the physical and mental well-being of Montanans. But in addition to that, to provide recommendations for preparedness and mitigation. And we used a lot of graphs and and images today. But in doing that, I also want to remind everybody that the report is about people, the elderly, the young, and about allowing people to continue doing what they are, what they want to do in their lives, despite the many changes in climate. So let's move on. This image, which is included in the report, was first used in the Lancet Countdown US brief in 2018. We selected it because it does such a good job of summarizing the many different aspects of climate change that will and how it will impact our health. Across the top are termed climate pressures, increased temperatures, more extreme weather, rising sea levels, and extreme precipitation. Across the middle are what are called exposure pathways, or how those will manifest in terms of our health. More extreme heat and heat waves, more air pollution, which we'll talk a little bit about, water contamination, changes in vector ecology, increased allergens, and particularly important, food supply quality and quantity, and also a little bit of population displacement. And then at the bottom, how it affects us as individuals. Heat stroke, cardiac and respiratory diseases are increased, gastrointestinal diseases are increased, more infectious diseases, and often underappreciated are the profound mental health aspects and the potentially large impacts on both pregnant women and their fetuses. And then last but not least are the physical trauma related to many of these events, whether it's storms, floods, or wildfires, which we'll talk more about. Let's start with heat. One of the major aspects that will affect Montanans are changes in heat, and included in the report and in the original Montana climate assessment suggests that annual temperature of 4 to 6 degrees by mid-century and possibly as high as 9.8 degrees Fahrenheit by the end of the century. And this shows how that will play out, or how it's expected to play out. This shows days over 90 degrees Fahrenheit are expected to increase as much as 35 days per year. And obviously this will have increasing influence on the onset and severity of drought. But this report took it further, and a lot through the work of Dr. Nick Silverman. We took the heat information from before and overlaid that with multiple demographic and socioeconomic factors. And this shows how that manifests. Many counties in the eastern part of the state are at medium to high, and one county, Roosevelt County, came out as very high risk for feeling the impacts of heat. And it happened to be that Roosevelt County came out high because it was kind of a confluence of being in the areas that will be the hottest, and also having high unemployment rates and other socioeconomic factors that affect people's susceptibility to heat. And this is just a reminder of the many different ways that heat can affect us. It can affect our thinking, our heart, our lungs, a variety of others. But I particularly want to call your attention to the lower right-hand corner where it talks about pregnant people, because heat impacts results in increased stillbirths, increased preterm delivery, and also can have effect on the fetuses as well. And it's important to note that it doesn't take extreme heat for that to happen. That can happen at very minimally elevated temperatures. As it gets hotter, we get more of that. The other major impact that we expect or found on the health of Montanans relates to wildfires. Now, no one is saying that wildfires are exclusively the result of climate change. Certainly our forest management practices of the past 100 years of fire suppression is a factor, but the increased drying from increased temperatures, increased transpiration from the plants, increased spread of pests, as well as less winter kill from pests, all have significant impacts and increased wildfire frequency and the amount burned. A report in 2017 suggested that 70% of the increase in fires we're seeing in the past couple of decades is the result of climate change. And this shows the number of days of extreme fire danger over time in Montana. The top lighter colored map is the historical average. The middle shows the anticipated increases by the mid part of the century under the RCP of 8.5. And then the bottom shows the differences. And basically, you can see that almost all parts of the state have huge increases in the risk of extreme fire danger. And this looks at it a little different way, kind of a busy slide, but it shows the bar graphs are wildfire acres burned. And as expected, it varies from year to year, though it has been increasing over time. The line graphs show the different impacts on the numbers of communities, counties, and others, from moderate to unhealthy all the way up to hazardous. And it's worth pointing out that in 2020, Montana had about 370,000 acres burned. And so far through this week in 2021, it's about over 800,000 acres burned. And in terms of health, this may be the more telling image. And this is from in the report and from 2017, but we could equally take them from this summer as well, showing how far the spread for wildfire smoke is, which gives an idea of the number of people that it can impact, even very distant from the fires themselves. Which brings us to air quality. Now, we need to point out that air pollution in the United States, or overall, our air quality is better than it was 2 to 3 decades ago. And that's primarily because of the Clean Air Act and the work of organizations like the American Lung Association. Despite that, every year, air pollution contributes to estimates from 68,000 to as many as 250,000 deaths in the United States. People who would not otherwise die were it not for the existing air pollution. Perhaps more importantly is the fact that despite that improvement in air quality, it has not slowed down climate change. We have to do more in that regard. Now, how about in Montana? Well, according to the State of the Air rankings from the American Lung Association in 2020, Montana cities and counties got an A grade for ozone, not a big issue for us. Particulate matter, a little bit different story. 10 counties got an F, 2 a D, and 1 a C. And the point below that may be even more telling, and that is that year, only 7 counties collected ozone data and only 13 counties collected particulate matter data that was submitted for the report. And not to pick on Missoula too much, but we will pick on the city a little bit because that year they were 7th worst in the country for short-term PM, and annually, spread over the year, tied for 16th worst. The difference in Montana compared to a lot of places is most of our bad days are due to forest fires or wildfire smoke. In fact, studies have also shown or suggested that over recent years, as much as 25% of the worsening of particulate matter is due to wildfire smoke, and then in the Northwest, as much as 50%. How does that relate to people? Well, this was a study from out of U of M by Orr et al., which showed the lung function of people who were exposed to the Seeley Lake fires in 2017. And the blue lines are females, the yellow lines are males. And what we see across the top, in the dashed lines, are the expected lung functions or of people. What we see in the solid lines with the significant drop off over 2 years is that those people exposed have a significant decrease in their lung function that persisted over the period of the study. A couple of other things to point out which are not in the report, because this is information that came out since the report was released, shows that increases in respiratory hospitalizations are increased relative from particulate matter related to wildfires compared with particulate matter from other sources. We also saw that a separate study showed that PM 2.5 levels were associated with increased asthma hospitalizations and emergency room visits. Again, these are from wildfires. And that was worse for females, and it was worse as people got older. Even though children are impacted, adults and elderly were more likely to be impacted. And the last one is from a study out of California, which estimated there were about 7,000 excess preterm births attributable to wildfire smoke exposure in the years 2007 to 2012. That was about 4% of the preterm births during that period. Now consider that the wildfires, especially in California and along the coast and in the West, have been dramatically worse since that time. So those numbers are likely to increase. We expect to see some water-related illnesses. These are related primarily to flood events, but also to drought, with some particularly gastrointestinal illness. And in the United States, overall, about 2/3 of gastrointestinal outbreaks are related to extreme precipitation events, but not necessarily floods. The other aspect, particularly in Montana and other states, which may be a factor or is a factor, and that's increased harmful algal blooms. As waters warm, particularly cyanobacteria or blue-green algae can proliferate, which can impact human health, certainly can be lethal to pets, but also important in our area, in our state, is it prevents tourism and recreational use of those waters, as well as the impacts it has on the fish and others. We noted food security and nutrition concerns for a variety of reasons. Elevated CO2 levels can lower the protein and micronutrients in grains, which risks malnutrition and anemia for populations at risk. The elevated temperatures and extreme weather events can lower crop yields, which can also result in increased food prices, again affecting lower income populations disproportionately. And even though we will have a longer growing season, we also anticipate hotter and drier summers, making predictions as to crop yields very difficult. But that goes along with likely increased stress on surface water supplies and broader spread of weeds, insect pests, and pathogens. We expect to see spread of some diseases because of broader ranges of the vectors, mosquitoes, ticks, insects. But in Montana, that needs a little bit of tempering. This shows tick-borne diseases reported to DPHHS for 2003 through 2018. On the left are the years, and on the bottom are the actual total number of cases reported. And while there's been some increase, it's worth noting there's still only 20 to 30 to 35 cases reported from tick-borne illness, and a significant number, the ones in green, were acquired outside of Montana. If we look at a West Nile virus, which is transmitted by mosquitoes, this was included in the report, and there are a modest number of reported cases, both human and equine, in 2019. But if we move to 2020, there have been very few cases reported in Montana, which is good. But if we look at the national level, things are much different. Just for perspective, from 2004 through 2016, the number of cases from infected mosquitoes, ticks, and fleas tripled. Now, a significant number of those are from Lyme disease, but other diseases as well. So the trend is definitely there. One of the most profound impacts are on mental health. And this is from a study included in the report, but which was conducted and showed that ranchers and farmers self-reported anxiety levels related to climate change of about 3/4 of them reported moderate to high anxiety or concerns. The impacts of heat on mental health anywhere it shows worsening mental health status, decreased cognitive function, decreased thinking, increased violence, increased interpersonal aggression in the form of domestic violence, rape, and abuse, more suicides. And one study showed that even a mild increase in average temperatures going from 77, using a range of 77 to 86 to above 86 led to significant increases in mental illness. Now, we could change this to also say extreme weather events and mental illness, floods in coastal areas, hurricanes and other storms, but drought and wildfires have very similar impacts on mental illness. In Montana, where we rank high for suicide rates, about twice the national average for the early part of the 20 teens, going as high as with marked increases in our suicide rate during that period. And in 2017, we had the highest suicide rate in the US. If we superimpose those climate effects on this, things get even worse. The other concerns is the paucity of mental health and behavioral health providers in our state. We need significant help in that area. And with that, on that somber note, I'm going to turn it over to Lori for a little bit better news.
I get the more fun part of this. Thanks for being here. Rob and I experienced a flood in Bighorn County in 2011. I-90 was closed. The public health nurses delivered medicines by boat. It made national news for a couple days, but it didn't make the news for long. A week or two later, all the waters were receded, and it would appear on the surface that everything was back to normal. But what we saw on the ground and in the community is that it was not all over. The people who were just getting by and then lost their home or had their drywall destroyed or all their clothing destroyed, for those people without backup resources, some of them years later were still living with another relative or in a car or in a FEMA trailer. And it's hard to live a healthy lifestyle in those circumstances. Every time there's a severe weather event, and they are increasingly more common as the planet warms, of course, this happens to disadvantaged peoples. After working with under-resourced communities for our entire careers, this was one more wake-up call to Rob and I that climate change is serious and unfair. So in C2H2, we look at the most vulnerable people, and that includes groups that you would normally think of, the older people, the younger people, the pregnant people, the indigenous populations, the poor, and people who already have chronic medical conditions. But it also includes outdoor workers, largely in part because they're exposed to the elements a lot more, and rural populations, largely because they have less access to resources in general, including healthcare. So there's a whole chapter in C2H2, as we call the report, that first looks at current health statistics and access to healthcare, and then looks at each of these groups. For example, in Montana, we rank above national average for people over the age of 65, and they're vulnerable. We have double the national average of people who are housed in mobile homes, 10% versus 5%. And the thought of living in a trailer in the summer or winter in Montana is not pleasant to me. We have higher than average people lacking health insurance and people with disabilities. Climate is a risk multiplier. So for those of you not in healthcare, you might not have heard about the relationship of zip code to our health. When we were at the American Public Health Association meeting about 10 years ago, there was a huge banner hung across the entrance that said, "What's your zip code?" And since that time, people have started looking at this increasingly. But based on our zip code, we can estimate your access to healthcare, your access to healthy food, poverty levels, race, your exposure to pollution. On a Robert Wood Johnson Foundation site on What's Your Zip Code, they show the national average age in the US to be 77, but in Bighorn County, it's 68. In Missoula, 79, and Bozeman's a high-ranking 82 or 83. Again, climate is a risk multiplier to those people who are already under-resourced. This is a satellite image, a little bit confusing, but I wanted to show a Montana example. This is Missoula, in case you can't recognize it. It's showing maximum land surface temperature over a period of time. Beyond the urban heat island effect, it also shows the topographic impacts of mountain ranges, showing that the south-facing slopes are considerably hotter. It's a Montana example of the differences in heat and the heat islands as we see them in our towns and cities. Based on where you live, within even a small geographic area, there can be 5 to 10 degrees difference in temperatures, and that makes a big difference when it's super hot. Heat islands tend to be in poorer parts of the town where there's more concrete and fewer trees. There was an occupational heat study done in about 2019 by Dr. Sally Moyse and Emily Healy at MSU. The Department of Labor divides up our work categories, and the top category on her chart was the ag, forestry, fishing, and hunting category, which of course is largely outdoor laborers, and they were the most affected by heat in Montana during the time of this study. Amongst the Native American residents of our state, their language, their ceremonies and cultures and practices and food sources evolved in concert with their homelands. When the land changes, that changes harder for place-based people. And for these reasons, as well as having less access on average to healthcare, our Indigenous peoples are more at risk. But at the same time, a number of the Montana tribes are planning for climate change. The SKC and the Blackfeet have prepared beautiful reports and are acting to adapt and mitigate to climate change in manners appropriate to their tribes. For example, among the Blackfeet, pardon my pronunciation, but the Siksaki beaver mimicry project has been created to recharge the aquifers, which will hopefully help the traditional food sources survive. And they're considering reintroducing the buffalo, which is a more climate adaptable food source than cattle are, as well as more culturally relevant. So this leads me to the topic of hope. And hope lies in action and in doing something. And there are actions we can all take to make a difference. And there are benefits to ourselves in the short term for doing so, because it's been scientifically proven by our psychologist colleagues that doing something, fighting back, makes us feel better. So Chapter 5 in C2H2 discusses what we can do. It's divided into suggestions for communities, practitioners, healthcare institutions, and individuals. Since most of you are not healthcare providers, today we'll look largely at the community level actions, but I'll also address some of the healthcare related actions, because those of you who are not in healthcare can request this of your provider or your healthcare facility. I think one important thing for those of us who feel like we're already helping humanity, we're already in a helping profession, we're providing healthcare, we're doing ethical research, we're teaching the next generation, we all need to get out of our boxes and silos to address climate change. That we includes our group of health professionals, but also scientists and educators and everyone else. The problem's big enough to need all of us, and there are meaningful actions that we can all take. So this slide talks about finding others to collaborate with. We note in C2H2 that collaborating is one of the best first steps. We get more buy-in from the community, we get more manpower, grant writing is more successful. So look at the data as to what's affecting your community and see what the members of your community care about. For many of our communities, it is wildfire smoke, but in some it could be the warming waters with declining fish populations and the loss of revenue and income because of wreck tourism being heavy in those areas. It could be the loss of indigenous traditional foods, or lowered water supplies for your town, or algae blooms. Or it could be concerns for sustainable agriculture, a movement that positively gained momentum during COVID. So Rob likes to say that climate change is the world's greatest participation project. If we work together, everyone wins. To get buy-in from some collaborators in our communities, we need to consider economics. You'll hear more about this in future Rough Cut sessions like next week with Dr. Rich Reddy. But as we are learning, public health crises, of which climate change is one, impacts human physical health, mental health, but also economic well-being, which in a cycle also affects our health. And this is another reason to take action. So Moody's Analytics is a top-tier analysis group and an independent bond rating company. We're finding that cities and regions that are not considering climate effects in their planning are getting lower bond ratings. And this sort of information might help you and your community gain buy-in from the governmental groups. Audrey Wallesser works with Ready and Safe Montana and with the Disaster and Emergency Services, part of DPHHS, and she notes that there's millions of dollars of funds, both state and federal, for mitigation of climate change that go unused every year. So contact her and see if some of your projects might align with the monies that they have. So one thing we all can and should do is talking to people, and that includes our families, our friends, our colleagues, our students, our patients. Catherine Hayhoe, the famous climate scientist and also famous climate communicator, says this actually might be the most important thing that we can do. I'll give you just a couple examples for our healthcare provider friends, and then we'll address community-wide issues. So with our patients, we can talk with patients about who have lung disease about climate, and that seems like a pretty easy ask. We can educate them on the health effects of wood stoves and gas stoves, the fact that diesel buses hurt our school-aged kids, the fact that our inhalers don't work well after they're exposed to heat, that no idle zones would be helpful in our towns and our cities and our schools. Change over to electric school buses would be helpful. But most people are a little uncomfortable doing that with other kinds of patients. But we can talk with other patients too. New research published just last week by a pediatrician colleague noted that 80% of the parents strongly agreed that the impacts of global warming on their child's health should be discussed during well-child visits. And this research was done in a fairly conservative part of the country. There's a lot of resources out there, both in the health community and otherwise, to help get us all started. The CDC BRACE model, or Building Resistance Against Climate Effects, has some great resources, but all of your favorite public health agencies have great resources, including the Association of State and Territorial Health Officers, the Institute for Tribal Environmental Professionals, NACCHO, that's the city and county health officials, the American Public Health Association, and more. But for those of you who are not in healthcare, doing projects where healthcare can be incorporated really helps the success rate. Again, there are citizens and decision makers in all of our communities that don't care about climate change, but they usually do care about human health. If we can have reasons for our proposed actions that include benefits to human health, we will get more buy-in. And if you can't find a health professional in your community, the members of the Montana Health Professionals for a Healthy Climate are willing to help you. So a couple more on health before we go to the community. Healthcare Without Harm is a worldwide network of over 17,000 hospitals making a commitment to sustainability. They work to transform healthcare and reduce the environmental footprint. They look at environmental waste, toxic materials, the chemicals, green building, energy, food, pharmaceuticals, and more. Providence St. Pat in Missoula is a starship in Montana. They are part of the Providence Health System, who has made the strongest climate commitment of any U.S. hospital system to date. Their climate strategic plan is to become carbon negative by 2030, and that includes scope 1, 2, and 3 emissions. Dr. Beth Schenk, who's on our board, is the sustainability director for the entire Providence system. The Sisters of Charity of Leavenworth Health Hospital System has recently joined Healthcare Without Harm also, which includes several hospitals in Montana. At the clinic level, there's hundreds of clinics that have signed up for My Green Doctor. It's a free, evidence-based means to decrease carbon footprint and save money in healthcare offices. So ask your local provider. So within the community, Several programs and collaborations in Missoula have led to arranging for homemade HEPA filters for community members that can't afford a real HEPA filter. Remember, for some of those people in substandard housing, their inside air is frequently as bad as the outside air. So if they can't afford a real HEPA filter machine for their house, these homemade ones actually do get rid of a lot of the particulate matter in the air. So in other communities, we might find grants or end of year money or a benevolent person in town whose family member has asthma. It's a great project to get service organizations involved with. Many of you have seen these air quality charts more than you want to in the past few years. Before that, it really wasn't too familiar to most of us. And thanks to DEQ and DPHHS for posting it on their websites. We've also seen all too many of the air quality maps that look like this during times when we aren't even having fires in Montana. Because of this, the Montana Academy of Pediatrics Climate Committee wrote a grant to expand the adoption of the air quality flag program. The way it works is this. They look at an AirNow app on their phone and check it daily, and the correct color of flag is raised by a student. It's a great way to educate the school kids and the staff, but also the community about the importance of air quality and health. Where you can help us and do your climate action for the week is that we need contacts in the schools. A suggestion or an introduction from you will increase our success rate much more than a cold call from a stranger. We can provide free flags and flagpoles and on-site education. It's also available for NGOs and churches and government agencies and businesses. So it's been a while since the air quality map for Montana has looked like this. But this shows us the weather stations that we have in Montana, and there's under 30 of them for the whole state. And if you look at that top diagonal northeast corner, there aren't many at all. And also on this map, the round circles are the official weather stations. The little squares are purple air monitors and other monitors like this. So the one that's a little bit east of Billings is where we're sitting right now at our house. So with the grant that we have with the Academy of Pediatrics, we can also get purple air monitors for the schools in communities where they're not near to an air quality monitor. The Crow Tribe raised money to get a weather station a few years ago. And there are actually several organizations in our state that will be collaborating on an EPA grant this fall to try to get more air quality stations in Montana. We need clean air and cool air spaces in Montana, as we've seen this summer. People in substandard housing can't escape that bad air. And not only is the inside air as dirty as it is outside at times, it's sometimes as hot or even hotter in some of these substandard housing. So this is something a community can arrange without too much effort or work. It might be as easy as talking with the public library or a school or a fitness center to get an emergency center arranged, and then letting the community and the health people, the healthcare workers and public health people know about this. Involve your DES people in such a problem, in such a project too, the disaster and emergency response people in Montana. They are in every county. If you live in the state of Oregon, you can call 211 to find a center and get transported to one of these centers. We might be a couple of years away from that, but it is a good goal. Community awareness campaigns are really important. So Missoula's Climate Ready Coalition did a Wildfire Smoke Awareness Week this summer with events and presentations, and more of our cities and towns could be doing this in the future because public awareness is really important. Your community's biggest concern might be water. And the Montana Climate Assessment points to less rainfall in the late summer, which frequently means lower stream and reservoir levels. The Musselshell Watershed Coalition is a partnership of individuals, organizations, and agencies working towards management of the entire Musselshell River Basin. I know a lot of you know how important housing is for patients with health problems. Good research shows that decent housing also improves our general health, our mental health, and not just our lung health. And a weatherized home lessens energy bills and decreases carbon emissions for heating and cooling. So there's a lot of reasons to desire decent housing for our patients and less resourced community members. We have colleagues working with Green and Healthy Housing on a grant to improve reservation county housing. Climate Smart Missoula worked with their city county health department and others in Missoula and got a Robert Wood Johnson grant a few years ago to look at housing and improving housing for poor people. And really almost anything we do to improve housing improves both our health and is friendly for the climate. Look at sustainable construction for all of our buildings. Our homes and buildings can be net producers of energy. We can adopt stricter local codes than what we have in the state. Currently, the Montana Department of Health is considering whether to adopt the IECC or the International Energy Conservation Codes for 2021. Let them know that you want this done. It'll help lower our emissions. We can work building-wise on fire-resilient communities, educating homeowners on the proper landscape management, do a public service campaign, and find out how much people will save on their homeowners insurance if they do this. And we can support sustainable agriculture as a community and also with our pocketbook, because sometimes it costs more. Most of you know this, but planting trees can be really helpful in our towns and cities for climate. What some of you might not know is that they actually do a whole lot for human health. Good peer-reviewed research shows that after adjusting for socioeconomic status and race and income, people who live in urban areas with trees have less obesity, less diabetes, improved mental health. It's pretty impressive data. Even in Montana, our towns and cities have that heat island effect where poorer communities with fewer trees and more concrete hold more heat. And those communities are also less likely to have air conditioning or even fans, or to be able to afford the energy bill if they turn them on. So trees really do help. They do a lot for climate and for human health. If you're not a member, join on with Climate Smart Montana. They really help us to collaborate and work with municipalities and help us with the tools to address climate change. Join the Bozeman Climate Alliance to find out when climate events are going on across the state. Montana Health Professionals for a Healthy Climate collaborates also. We have allies in some of the medical organizations in our state. It's the AAP along with Montana Health Professionals that are collaborating on the Air Quality Flag Program grant. We have 2 presentations this week in collaboration with other groups. And we're willing to work with your communities that don't have a concerned health professional that you know of on your climate projects. And sign on with us. That's your second climate action you can do during the time of this talk. It strengthens our voice. Nick Silverman is a climate scientist and he's on our board. We welcome concerned scientists. There's no obligations. And if you have any questions, any suggestions, any requests, you're free to contact us anytime. And that's all we have.
Thank you so much. I appreciate all the attention to things that can be done. So we have a really nice, robust group here, and I really want to thank those of you who are not normal Rough Cut attendees. It's great to have you here. We're really glad you could be part of the community and conversation. So you can put questions in the chat for Rob or Lori, and you also are welcome to unmute yourself and give it a go with respect to asking questions. I'll kick one off while people are thinking about it. I have, in my energy and society class, I teach about the principles of the idea that we're not going to be able to adapt every space to our heating and cooling needs. And so these shared spaces are really important. And I was really glad that you mentioned cooling centers, Lori, and I'm just wondering how, if you want to expand on that, how many such things exist? Is there an inventory in the report of where those are lacking in communities? I think it's a really interesting and important topic.
I'm not aware that there's any in Montana. I've heard there's been some conversation in Missoula recently. If anyone on this call wants to correct me, I would love to hear that there have been some created.
And I will point out that that can be done and still maintain safety relative to COVID.
Okay, well, I encourage others to throw their questions out there. Sometimes it takes a minute with people online, but they will come. I know they will.
Hi, my name is Taylor, and I really enjoyed your guys' presentation. I was just wondering how you would define sustainable agriculture.
I think there's people on this call that can explain it a lot better than we can. I think that a lot of things that we do for our food system helps climate, and some of them obviously help it more. I mean, supporting local farmers markets and CSAs, and supporting organic farmers and sustainable farmers. But I think maybe Bruce Maxwell would be better to answer your direct question.
You're putting me on the spot.
No.
We are, Bruce.
Well, I think that one that just to be relevant, I guess, to your talk, one that an agriculture that can maintain food production through conditions, all kinds of conditions, is one that would be sustainable, be resilient to the kinds of changes that we anticipate might come with climate change. An important aspect of that isn't often included in that definition, however, is the quality of those foods, which I know that Lori and Rob are thought about and can probably add more than I can on that. But nonetheless, I think that there's really, it's an important question. Sustainable agriculture has many dimensions to it, certainly, that cross the line from just production to equity of where the food goes and it's distributed, etc. So I'll just leave it at that for now. But there's many definitions that you might find that would be inclusive of a lot of these ideas.
Taylor, would you like to answer that question from your own viewpoint?
Sure. I really liked your definition, Mr. Maxwell. I think I really agree with that. I think sometimes sustainable agriculture is often synonymously thought of with not conventional, and I really believe that conventional agriculture is often sustainable as well, and that, you know, I'm a proponent of all ag, and so that was just kind of my belief system aligned with your definition as well. So I just was curious of how that was defined in the realm of the climate change and that sort of thing. So thank you.
Thanks for that. I'm going to read Dr. Kathy Whitlock's question that came up in the chat. I've read that 5 million people globally die each year from causes linked to climate change. What do we know about Montana, and how can we better track that information?
I'm not sure we have good statistics on that. And another one related to that is that probably over 7 million people globally die related to air pollution. Now, obviously there's overlap in that, as we discussed. In terms of how we can do better on that, as a physician, and all the physicians in the crowd and other healthcare professionals understand, is if somebody comes in to, say, a hospital with a heart attack, rarely does anybody make note of the temperature. And having better data on that and correlating those types of things will help us a lot. One of the issues that we dealt with both in the report, and that's a big issue everywhere, is a lot of that information isn't correlated in the interest of patient privacy. So doing better on that would be helpful. A separate thing, one study is to give a perspective, maybe not related to Montana, but one study from last year suggested that in the month of August and September in California, there were about 3,000 deaths just related to the wildfires. You know, keep in mind that nobody or very few people will put patient died of respiratory failure and there was a wildfire going on. Those correlations, it'd be great if we could, but quite honestly, as healthcare professionals, we don't make those correlations. We need to do better.
especially for wildfire data, we really have to have a lot bigger population base than what we have in Montana. And that's why you do see a lot of the data coming out of California. There's been a couple of good studies out of North Carolina, but you really just have to have more population than what we have to be statistically significant.
Can I ask a question?
Please do.
Rob and Lori, I'm curious as to what you think, where or who, when I say who, I mean agency or maybe it's a non-governmental group even, should be responsible for organizing the data that is there and hopefully will increase over time and be able to make reports on a regular basis so we know more about what these climate effects are. Who should be responsible for that?
Great question. And as one we found out in doing the report, some of that work is going on through our state health department, correlating using information or data they have from both emergency room visits, which is reported to them. It's sanitized, so it doesn't give specific names or anything. For both symptoms, so somebody comes in with shortness of breath or an asthma attack or even a sore throat, that's one thing. And the second is they also have data, and this is standard for state health departments, on discharge diagnoses from hospitals. Trying to bring these together and doing more of it because not all hospitals report. I want to say it would be great to have our public health departments doing that, but that's a huge ask and requires significant funding and significant coordination between different organizations. Now, our state health department has been trying and has been doing a good job, but we need to do more and do better.
I just, if I can ask another question, I just read a report on the costs of wildfire that came out of California. And one of the things that was really clear from that report is that they don't really know the long-term costs of wildfire, and that's in terms of health. It's also very hard to figure out the downwind costs of wildfire. And there's not even monitoring of firefighters and their long-term health trajectory as related to fire exposure. So it was pretty enlightening to me to see how little we know about long-term and downwind and even acute exposure costs of wildfire.
True. It just, sorry. Wildfire, just compared to other air pollution, is just so much more difficult because it's temporary. And so, for example, when you look at the pregnant women, which is a really important aspect of the research, well, what phase of their pregnancy were they in? And is the researcher looking at a week of wildfire smoke or a month? And was it at the red level or at the purple level? So there's just so many factors that go into it that make it really difficult to measure health effects of wildfire smoke. And you're right, the long-term effects, I mean, we know that smoking is bad for our bodies, and we know that more smoking is more bad, and we know that air pollution is bad. But again, if you have a terrible summer and then you move somewhere with better air, are you permanently damaged? There's just a lot of questions we don't know in medicine.
Well, I'll just in our last moment for questions, I'll throw in one that came from our Dean of the Library, Kenning Arlich, who asks about some recent research, and he provides a link that's linked wildfire to an increase in COVID-19 incidents, including deaths. And did you have any comments on that? Yeah,
That's going to be fascinating to see how that pans out, and that was a very good study. And it's worth pointing out too that other studies have related COVID deaths and more serious illnesses to increased air pollution independent of wildfires. That came out earlier in the COVID pandemic. So the question is, and stepping back, is we talked about particulate matter a lot. actually particulate matter, PM 2.5, which are the smaller particles that actually get in deep into our lungs and actually get into our bloodstream, aren't just inert particles. They're particles, they're chemicals, they're heavy metals, but they also can carry biological action, i.e. viruses. So there's a question is, are they transporting the virus, or is it the fact that the wildfire smoke is damaging people's lungs and makes them more susceptible to the virus in the first place? We don't know the difference. My suspicion, it'll be a little of both, but mostly the damage to the lungs. And I say that because of the separate information based on the correlation with air pollution independent of wildfires.
Well, I don't see any microphones turning off or any final questions. So this will give our attendees a minute to get off to their next class or engagement. And I just want to thank you so much for your leadership and commitment and a really wonderful presentation you've provided. Your contact information and the IOE is happy to facilitate connections with the Byrons for anyone who wants them. So why don't you turn your microphones off and give the Byrons a round of applause. Takes a minute.
And thanks for the opportunity.
Thank you.
Thank you so much for being here. We really appreciate it.
Thanks.
Well, before everyone signs off, Rob and Lori, I was just thinking that, I always need, I like to, the energy class I teach in the spring, I always try to do some, applied little research exercises, and they're all geographers. So thinking about that cooling center one, probably somebody else is doing it, but I do teach a whole thing on cooling centers because they really use them in Australia where they obviously have huge heat issues. Right. But it'd probably be something that would be relatively straightforward exercise in categorizing existing buildings. The question is whether cities and public health information officers are kind of using them that way.